How to prevent cancer. Early screening. Introduction. All tumors are cancerous. Select true or false. Correct. Only malignant tumors which invade other tissues are cancerous. Benign tumors are not cancerous. It is always possible to determine the cause of cancer in a patient. Select true or false. Correct. It is usually impossible to specify the causes of cancer in an individual patient. However, we do know what can cause cancer in people in general. A risk factor is anything that increases a person's chance of developing a disease, such as cancer. Select true or false. Correct. Will women who have never had children develop breast cancer? Select yes or no. Correct. Never having children is a risk factor for breast cancer and not a cause. Regular mammograms are recommended to screen for breast cancer. Select true or false. Correct. Your healthcare provider will help you decide how often to have a mammogram and when to start. To screen for colorectal cancer, should people have a stool blood test every 5 years? Select yes or no. Correct. People should have a stool blood test every year. Bleeding after menopause can be a sign of endometrial cancer. Select true or false. Correct. Signs of endometrial cancer include bleeding between menstrual periods or after menopause. Adolescent girls who begin having sexual intercourse while in their teens increase their risk of developing cervical cancer later on. Select true or false. Correct. Researchers believe that the cells in a young woman's cervix are more susceptible to changes that could lead to cancer than the cells in an older woman's cervix. A pap smear test is used to examine the cervix for any abnormal growth. Select true or false. Correct. Is lung cancer easy to detect? Select yes or no. Correct. It is difficult to detect lung cancer in its early stages. Thank you for using Explain.